And at the same time, this movement was pretty strongly embraced and maybe even provoked by the industry, right? And to the right, you have the Mexican George Clooney, which is actually, he's actually not Mexican. I think he was Argentinian, or he's Argentinian. And but this guy used to be, you know, a very frequent actor that you will find on TV in the late 80s and early 90s. And his name is Saul Lizazo. And I put it here because I think that I remember these TV commercials, you know, and the final phrase of any commercial this is for Bacardi, which is an alcohol company. And they will always finish saying, la calidad es responsabilidad nuestra, la cantidad es responsabilidad de usted, with a very deep voice. And basically what they're saying is the quality is our responsibility, but the quantity is your responsibility, which is a very good way of dodging the responsibility for a company. Now, there's been a change in that, and I think overall we would slightly laugh a little bit about this reductionist view of individual responsibility in public health. I think that over the last years, we have seen, you know, a pretty strong change towards trying to understand the structural causes of disease, and particularly the role of commercial determinants of health, the role of corporate responsibility, social responsibility, and also the absolute dependence that we have as countries or as nations regarding the connections that we have with other countries in the international setting. And finally, I think that right now our view of tobacco and alcohol is much more closely aligned, you know, from an individual perspective to conformity to the norm. And that basically means that we're going to be following the behaviors that we are seeing as valued and important and well recognized from a social perspective. And that is, for me, very powerful and very important to keep in mind, because basically it implies that if you change the norm, then you can change the behaviors. And then finally, we're also moving away from the use of the reduction of substance use to only addiction and only abusive consumption. I think that right now we are interested in any type of use, either you know, like low level or low intensity or high intensity. Perhaps the most important reflection of this change in our view of what is driving individual behaviors is the Framework Convention on Tobacco Control. And this is an instrument, an international instrument, and the first global health treaty to put together a series of actions and to identify a series of key aspects of the process of tobacco consumption that should be considered and targeted by policy. This framework was adopted in 2003 by 192 nations, and it became into force in February 2005. And it is actually a pretty interesting instrument, and I do encourage you to read it and to get acquainted with the process in which this treaty or this framework was adopted, because I do think that this instrument should actually become an example of the type of regulation that we should aspire to, not only for tobacco, but also for alcohol and perhaps for many other public health problems that require international understanding. Now, if you read the Framework Convention for Tobacco Control, you'll get an idea of how legal and how complicated it can be from a non-legal perspective, right? For someone who is not very well acquainted with all of these legal lingo. So what WHO did is to actually try to simplify the FCTC by moving it forward into a much more digestible form. And that more digestible form is Empower. And Empower is basically a set of measures, of actions, specific actions that nations are expected to implement to reduce tobacco. And you will see here on your left the type of actions that are expected, and those are much more easier to understand and of course to implement. So basically they say we should monitor, protect, offer, warn, enforce, and raise. And all of those refer to for instance, keep an eye on how tobacco use and tobacco policies are being implemented, protect people from secondhand smoke, offer help to quit tobacco, warn about the dangers of tobacco, and enforce bans on advertising, promotion, and sponsorship. And then finally, one piece which is absolutely crucial, which is increase the prices through taxation. So this is basically just, you know, like a very short list of actions, and these are not the only things that the FCTC include, but these are actions that are being proposed as something that we should do right now. If you read the FCTC, you will see that there are other provisions that are also fabulous and that we need to start working to develop, such as, for instance, reducing the types of substances that can be added to tobacco. And just to give you a quick example. Now, and here's where things start to get very interesting. WHO has not moved yet towards creating a framework convention on alcohol control. If you ask me why, I truly do not know very clearly, you know, what are the specific reasons why we are not moving in the same direction, considering that the Framework Convention for Tobacco Control has been so successful and so well regarded by all the signatory countries. It is actually very interesting, and I'm putting, you know, down below, you'll see down here in very small letters, a recent paper that is actually discussing the reasons why and some of the concerns that alcohol researchers have about the lack of a framework convention for alcohol control. Now, that being said, we do have something to work upon, and that's SAFER. And SAFER is actually a package of interventions that are similar to what Empower proposes, but those are dedicated only to alcohol. This was just very recently proposed. It was proposed in late 2018, and the package was published in 2019. And you will see and you will recognize that these are fairly similar, right? So they are asking to strengthen restrictions on alcohol availability, advance and enforce drink driving countermeasures, facilitate access to screening, brief interventions and treatment, enforce bans, comprehensive restrictions on alcohol advertising, sponsorship, and promotion, and finally, of course, raise prices through taxation and pricing policies. So. And I'm going to show you at the end how do they actually look when you put them together, because I do think that we need to be very careful to keep them together, and I think there are various reasons why we should do that. First and foremost, I think that everybody now understands that tobacco is a public health threat. It's something that we should be extremely worried about, and that we should keep a pretty strong surveillance over all of the actions of the tobacco industry. Now, if you look at that and at the perception that we have about tobacco, and you try to bring it to alcohol, you will very quickly realize that with alcohol in general, we have been much more accommodating, right? So we have not asked as many hard questions about alcohol as we should. And now, and I think that this is something that has to do with the history of alcohol and health. And if you look at some of the research on alcohol and health from the last maybe 25, 30 years, you will probably get the idea that alcohol was something that was healthy, right? I mean, if you were just drinking moderately, then alcohol was supposed to reduce your risk of cardiovascular disease and all of this. Now, the issue is that as we move ahead with other types of studies, and particularly when we start considering the role that alcohol has on cancer, for instance, then the picture starts to become less positive. And if then you take into account all of the secondary effects, if you want to call it that way, of alcohol over other people, right? Just like car accidents, where in the case of Latin America and perhaps the world, the impact that alcohol has on domestic violence and domestic abuse, then you have to start rethinking whether alcohol in general is a positive influence on health. And I think that at this point, I am pretty convinced that it is not. And that's why, in general, we should try to create these frameworks, pretty strong frameworks, frameworks that are devoid of the influence of the industry to actually move forward. A good question is if the FCTC is actually working, and here you can see some trends on cigarette consumption on different types of countries. And I think the fairest answer is that the impact of the FCTC is actually pretty heterogeneous. And the impact is pretty visible for high income countries, but for low and middle income countries, the impact has not been as clear, at least up to 2012, which is where this graph stops. And I think later on there's been some advances, and if you look at the Latin American region, you're gonna see countries that have made amazing improvements in tobacco control, such as Uruguay, and some countries that have done something but not necessarily the best. And I think that's the case of Mexico. I think Mexico still has many things to do moving forward. Now, one of the important questions is if SAFER will work, and the quick answer is that we do not know. I mean, as I was just saying, this was published 2019, so we still don't have any information about whether this will work or not. And as far as I know, in Mexico, we are just starting to work on the specific things that SAFER require. Of course, there are some policies prior to SAFER that were already implemented and that we are actually evaluating in the context of Salud Urbana, and I'll talk a little bit more about that later on. So of course, let's give SAFER some chance, and let's focus more on the FCTC, which has more time to have been implemented. And the question is, do we really think that the FCTC is going to be enough? And I think that's a fair question, and the fair answer is that we do not know if the FCTC as it is right now will be enough to actually bring us to an end game scenario. An end game scenario basically means that we will have new generations where tobacco will simply not be used. I mean, just to put it simply. And so we do not know if it will bring us as far as that, but we do know that it's working and that many of the provisions of the FCTC have been extremely helpful. Now, we also know that the knowledge is still evolving and that we will have to make some changes, and perhaps, and this is where I would like to direct my talk today, is to think about other specific avenues for control that we may be missing. And I think that there's a lot of things that we can learn from, for instance, the changes in food environment that we are seeing, and also some of the changes in transit. I mean, just to give you some examples. Now, one of the things that we do know is that the impact is pretty heterogeneous across signatory countries, and I think that we should ask ourselves why. And I think that there are many answers, right? First is, how important is tobacco and alcohol in the national agenda? And in my experience, that is absolutely fundamental. I mean, if the federal government and the local governments are not interested in these things, then it's going to be pretty hard to move forward. And also how much resources are being put into implementation, which I think is very closely related to how important these things are. And then finally, how well is being implemented. And I think that we are not doing enough job, trying to keep an eye on how compliant some of these laws are being from a societal perspective, right? So how compliant are we? And also by who? And this is actually a pretty interesting story. So let me talk a little bit about alcohol and tobacco use, and I promise I'll be brief. I just wanted to show you some of the things that are worrisome to us. And one of the things that you should know is that tobacco for adults is pretty much stable right now. We are still seeing increases in adolescents, and in alcohol use, we are seeing increases both in adults and adolescents, And one of the things that we saw very recently is a pretty strong increase in binge drinking in adolescents. So that's something that worries us very much. Now here, you can see the latest data that we have on cigarette smoking in adolescents. This is in Salud 2018, which is our NHANES. And as you will see, we are having around 6% or 5.5% of the total population of adolescents smoking. And there are some important differences by urban and rural areas, which is as far as we can see using NSANUD. So you'll see a slightly higher consumption in rural areas compared to urban areas for men, but not for women. For women, it's actually the opposite. But when we look at adults and then we look at the differences between urban and rural, then you can see very clearly that smoking is a higher problem, particularly for women in cities. And it's also higher for men, although not as noticeable. Now, if we look at alcohol use and we only look at current consumption, we will see something similar, right? Slightly higher levels of consumption for men and much higher levels of consumption for women. And then on your right, you will see this excessive consumption, which is basically binge drinking. And you'll see that it's similar for men in rural and urban areas, and it's actually higher for women in urban areas. And for adults, we are seeing something similar, and you'll see that the actual use is pretty high. We have around 45% of current consumption, and then we're having somewhere around 20% for binge drinking. Now, the important question here is, okay, we are seeing that there are some differences between urban and rural areas, but how homogeneous are things in cities, in urban areas? And the short answer is that we do not know. But let me just show you some interesting data that we actually analyze in Salud Urbana. And what you're seeing here is a paper where we had different countries in Latin America. And this one is only looking at Mexico. And first I would like to, so this graph is representing the prevalence of tobacco use in adolescents. And we have two points of data. On your left, you will see the prevalence at the first wave of data that we had, and that could either be 2003 or 2005, depending on the city. And then on your right, you will see the percent change, right, or the prevalence rate, comparing the post-FCTC to the pre-FCTC condition. And some important things. First is that we are already seeing some very large gaps in the data between the lowest and the highest levels of tobacco use in adolescents, but also when we see how things change after the Framework Convention was signed by Mexico, we're also seeing that each city is moving at a different speed, right? Some of them managed to reduce tobacco use in adolescents pretty strongly, like Hermosillo, which is this point down here. But then at the same time, we're seeing some cities like Tapachula or even Mexico City, which is really, really big, where there was actually no improvement or even an increase in the prevalence of tobacco use. And this is actually very interesting, right? Because why? Why is it that some cities are being able to move their indicators while others are simply not making any advances? And how is this going to affect the future? How is it that in the long term, we're going to have cities that are going to have much healthier outcomes than others just because we are not which is pretty interesting. Now, I think one of the biggest problems that we have right now is that we simply do not have data. This thing that I showed you came from the GYTS, the Global Youth Tobacco Survey, which is a set of surveys provided by WHO. But the latest data that we have is 2011, which is now 10 years old. And also, it is only focusing on capital cities. So we have a mix of state and city effects when we're doing these comparisons. Now, there are some things that we should not forget. And in the case of Mexico, given the very large percent of the population that we have living in cities, then
it's very likely that differences across states are actually being driven by differences across cities. So just not to get ourselves mixed. And also at the time, the laws for states were fairly similar. There were not a lot of differences in 2011. The problem is that we do not have any other information for other age groups, since GYTS is only restricted to school-based children. And we also, children and adolescents, and then we have no information for alcohol. And this is a huge gap in our understanding, right? Because if we do not have data, then it's pretty difficult for us to know what's going on there. But let me just move on and start asking what this heterogeneity means. And I think the first one is that, of course, there are some different sociodemographic and economic characteristics that are being important. And probably we also have some differences in the state level laws, although as I was saying, by the time they were not as different. Right now, they are probably much more different than at that time. But also, if we have the same legal framework and we belong to the same country and we have the same political structure, how is it that some cities move and some do not, and why? So we started to look at policy and policy implementation as a potential explanation for these differences. And we looked, for instance, at the percent of children who are reporting secondhand smoke at home. And we are seeing the same, the same heterogeneity, very large differences at baseline and very different speeds at which each city is moving to protect children from secondhand smoke. And let me just show you this one, because this is actually very, very interesting. We're also seeing some big differences in the type of content that adolescents are being exposed to at schools, what type of information they're getting regarding smoking. And this is fantastic, because in general, the federal government has a lot to say in terms of what is being taught to children and adolescents at their schools. So why is it that we have so much variability across cities, and we see some making excellent strides on improving the level of information, while others simply do not seem to move? This is another one just to show you that how often are adolescents being denied cigarettes when they are asking to buy them in stores. And again, we are seeing such a wide variety of responses that I mean, you just had to scratch your head and ask yourself what's going on and why is it that it's so heterogeneous. Now, we have done other types of studies, and this is a study that we did at the Institute a couple of years ago. And we actually went, to bars and restaurants in the state of Mexico, which is one of the largest states in the country. And then we selected cities, right? So we have Toluca and Naucalpan and Metepec and Tlanepantla. And we can see, even within the same state, under the same state law, there is some variability in the level of compliance that each group of venue, depending on the site, are having. And also with the help of Nancy and Francisco from the Salud Urbana team in Mexico, we started to look at other types of regulations that could also be heterogeneous. And then, for instance, we saw restrictions on alcohol availability depending on the time of the day at which you can buy alcohol. And even within the same state, this is Baja California Norte, where Tijuana and Rosarito Beach are placed. And you can see that in some cases, the municipalities will let you buy alcohol without food. Sometimes you have to buy it with food, and the schedules in which you can buy also vary depending on where you're placed, and also depending on whether it is a touristic place or not. And the same is happening with sobriety checkpoints. If you look, for instance, this is a map of Jalisco where Guadalajara is placed. And you will see that in some municipalities, we have sobriety checkpoints. And even in municipalities that are really big, more than 100,000 inhabitants, not necessarily are we seeing a large number of sobriety checkpoints, or there's even not a single program for sobriety checkpoints. And then on blue and gray, you will see those municipalities under 100,000 inhabitants. So it's interesting, right? I mean, we have, even within the same state, even within a narrow area, a lot of heterogeneity on implementation of the same federal and state law. And of course, that brings us to the question of who is responsible for the implementation of these regulations. And you should know that Mexico is a little bit different to the US, and I'll explain how. The federal government, just as yours, defines laws and regulations that are supposed to be implemented by states. The states at the same time are autonomous, so they have some capability to do their own actions, but they always need to be respectful of the federal law. But they can define specific laws if they needed them. And then finally, under states, what we have are municipalities, and municipalities are supposed to implement the state and federal laws, and they also have some space to define their own regulations. Now, municipalities are highly heterogeneous, just as states are highly heterogeneous. So there's always a question of how capable they're going to be to implement things. And of course, I mean, if you look at this and you see, well, there's federal, state, municipality, so you start asking yourself, so where are cities here, right? So where should I put a city within this framework? And my quick answer is that in Mexico, we have one city. And you will ask why? Well, we have one city because this city is Mexico City, which is in reality a city-state. For many years was a federal district, just like DC, and recently it became something similar to a state, although instead of having municipalities, it has alcaldías, which is similar to counties. But the interesting thing is that all of these alcaldías that you're seeing there, I think there are 16, they are all under the rule of a chief of government, and this is Claudia Sheinbaum right now. But this is different for the states, and let me show you how. Now, we could have, for instance, Guadalajara, which is a well-known city, a pretty big city. And as you can see on the left, that will be the map of the municipalities that conform the city of Guadalajara. You have Zapopan, Guadalajara, Tonalá, Tlaquepaque, Tlajomulco, El Salto, and other very difficult words to pronounce. And they are all coordinated by a governor. Now, there's a very significant difference between a chief of government and a governor. In the sense that a governor has to keep track of all of the municipalities of the state. So right here in the center, you will see all the municipalities that I was just pointing you at, and which conform Guadalajara city. And then you have all of these other territory who's also supposed to be coordinated by the governor. So as you can see, pretty big difference between coordinating a city and coordinating a city-state, of course. And I understand that Mexico City is huge. I'm not downplaying it. I'm just trying to point at the significant difference in the capability of coordinating, like 80 municipalities versus coordinating 16, and also 16 that belong to the same city, right? So cities do not exist as political entities for the exception of Mexico City. So if we want to work with cities, we will need to find a way to work with municipalities. Now, the good thing is that I think over the last 10 years, this problem has been detected and is being tried to be solved. And what is being done right now is that we are creating agreements for metropolitan coordination. And I know that Guadalajara has it, and I also know that Monterrey has some types of coordination, and also sometimes some budget to actually help with the coordination of municipalities. But as you can see, there is no measure of the city. Now, also, some of the actions are going to happen in a very vertical manner. So in general, the federal government proposes something that is being followed by the states, which in turn will move on to the municipalities. And as I was just saying, there's no information at the municipal level. So this is where we see an opportunity. And the opportunity is that there is a network of Mexican municipalities for health that was created under this Healthy Cities Project in 1985 by WHO. And that started in 1993 with 11 municipalities. But I think that right now they have more than 100 urban municipalities who could be very interested in participating with us in some of the ideas. Now, the question is, of course, how do we start working with them? And it is important to start, for me, to start thinking about the type of research and the type of interventions that we could propose. But I would like to do that always keeping track of empower and safer, just so that we do not get lost. So here you will see a comparison between both empower and safer. And there are some very interesting things. For instance, empower includes monitor as a key activity, but there is no similar task for alcohol. And then we have harm to third parties, which includes protecting people from secondhand smoke and advance and enforce drinking and driving countermeasures, which I think are in the same kind of target. They also provide use reduction, right? So cessation services for smoking and quitting for alcohol use. For tobacco, we have a warn about dangers of tobacco, but we do not have a similar thing for alcohol. In terms of enforce, both are actually targeting advertising, promotion, and sponsorship. Taxes and rising prices are both important. And then availability, it's included for alcohol, but it is not included for tobacco, although we do have some pretty strong evidence that availability of tobacco stores have an impact on smoking. So the idea now is, of course, why don't we use this framework to try to put together some of the ideas that we could have to intervene at the city level, municipality level, to try to reduce alcohol and tobacco. And I would like now to talk a little bit more about that. So if we were to focus on monitor, one of the things that I do see as an opportunity is to try to use surveys that we are actually obtaining regularly, and just to oversample in cities so that we can have better information of what's going on in some of the, perhaps we can start with very large metropolitan areas, right? I know this is expensive, but I think that if we put them together with some other surveys, such as the National Health Survey, that may be much more affordable. And with that information, we'll be able to understand the differences within and between cities, of course, but also to focus on who is being disproportionately affected within cities and how, so that we can try to reduce that impact. Also, we should try to obtain information on outcomes, right? So we should look at how much is being smoked or how much drinking is occurring. But we also need to keep a very strong track on policy implementation and perception of policy implementation, which is also very, very key. Now, in Salud Urbana, one of the things that we have learned is there's a lot of opportunities to use secondary data like registries. And I think that we should start mining data for 9/11 calls, which is something that we have not done. And also to start using more effectively mortality and hospital discharges to try to explore the direct, but also the indirect effects of alcohol and tobacco, right? So we have chronic diseases, which we all know, but there's also some information for accidents and for fetal alcohol disease. And one of the things that that I am very, very interested on is the impact of alcohol on violence. That doesn't mean that we should not pursue active data collection, such as trying to have a very good mapping of the regulatory and policy environments. And then finally, to produce evidence about the impact of interventions. And it is very interesting, but once you start working with local governments, one of the things that we learn very quickly is that they really want to have local evidence, or at least national evidence. And this is something that we learned very quickly with tobacco. There was a pretty strong international scientific evidence about the impacts of tobacco, but we needed something for Mexico to actually convince legislators, convince policy decision makers about the importance of that problem for the country. And at the same time, as we analyze impact, I think that we also need to analyze compliance, because sometimes compliance is something that we forget when we are doing impact evaluation. So how compliant is a municipality or a city with a specific norm or regulation? Harm to third parties, and I do think that there are some opportunities here, and I would like to set, a group of interventions that could be experimentally explored, such as, for instance, could we use new regulations and new offices that are being created in Mexico that, for instance, dedicate themselves to regulating the space, but also to regulate the interaction between people who have shared housing, right, such as apartment buildings, to try to use that to actually push for better outcomes for alcohol and tobacco. And here are some ideas. For instance, could we reduce secondhand smoke exposure through housing regulations, which is something that has been done in the international setting? Or could we move forward with banning smoking in cars as a way to both reduce secondhand smoke and also reduce car accidents? We need also to start evaluating much more consistently the impact of drunk driving countermeasures. And I would like to point at two specific papers that are being developed by Salud Urbana, which I think are going to be very, very useful on the impact, to show the impact of these types of measures and how effective and how strong they are. And also to try to harmonize blood alcohol levels for alcohol impairment driving, which right now it's pretty heterogeneous. So try to bring them all to 0.05 and then evaluate. One of the ideas that I've been playing around on my head with a lot more interest recently is the possibility of dram shop liability. And this is something that doesn't exist in Mexico, but I do think that is a pretty powerful idea. And it's basically this idea that you will collect data for the last place where someone had a drink prior to being involved in an accident or in a violent encounter. And then to start building up this information, this data set, to try to identify which specific businesses or types of businesses are being linked to excessive provision of alcohol. And once you can have that information, then it is possible for you to start moving towards creating a shared responsibility on alcohol drinking. There's an individual responsibility from the people who's drinking, but then there's also a responsibility by someone who's seen that someone is already drunk are still providing alcohol to them. And of course, one of the things that we could do is to evaluate compliance through sales, right? Because we know the volumes and the amount of money that is being raised through alcohol sales. And we could basically try to calculate the number of standard servings that are being sold in different venues. Now, in terms of enforcement of advertisement, there are a lot of opportunities. We are not restricting promotions as much as we should. And I think that this is something that could be implemented at the city or the municipal level very easily, such as forbidding open bar, ladies' nights, happy hours, and to condition that to alcohol licenses. And I think that we do have a pretty clear mechanism to do that. Also, to ban alcohol and tobacco advertisement from government and government licensed areas, such as buses, metro, and parks, and to be better in terms of defining the types of restrictions that we want in terms of advertising for points of sale. So for instance, in Mexico, if you go to an OXXO, which is a pretty common convenience stores, you will see behind the cashier this type of thing, right? So you see all of these cigarette packages just behind. And why is it that they have to be there? Why is it that they cannot be just under, and then if you want one, then you can ask for them. So those little things can have a pretty large impact. And then availability, which is something that everyone who works in urban health will very quickly connect to. And it is this issue of the density and the conglomerates of places that sell alcohol, tobacco, and the impact that those can have in terms of making these products much more available to the people, right? So why don't we have a pretty strong restriction around schools and recreational centers, and we're actually looking right now at that with Francisco and Nancy, and also to define a maximum density per square kilometer in any given place to prevent clustering, because that's also one of the things that we're exploring now with the help of Arantxa Colchero and also with Carolina Perez. And then finally, to start looking at alcohol selling schedules, just because, as I was mentioning, it is pretty heterogeneous across cities. So I hope you like this reflection, and it's basically to try to provoke you and also help us get a much more structured idea of the types of possibilities that cities entail for tobacco and alcohol control. And I do think that we should keep working to understand the intersection between city characteristics, urban characteristics, and substance use. I think that we also need to push for better monitoring, to have data that is much more localized, more granular, so that we can detect and understand where is it that these problems are being much more pervasive. But also, once we have that understanding, we may be able to harness and to learn from cities that are making strides, very quick movement and are gaining speed for policy implementation, and use that learning for other cities that are being left behind. And then finally, to analyze the impact of city-level policies on substance use. So for us, the question, and I would like to ask you also to think a little bit and to share about the avenues for structural interventions for long-lasting change that you can see from an urban perspective. Muchas gracias y ha sido un placer. Thank you very much for having me.
Great. Thank you, Tona. I'm sure I speak for all 40 of our attendees to say that that was excellent. We do have a few questions in our question and answer. So Usama asks about recreational marijuana legalization. Specifically, it's becoming more and more common and is already legal in many states, as well as Mexico and Canada. Are there any lessons from Empower or Safer to address the same issues we've seen with tobacco and alcohol now that we have the chance to regulate kind of from day one?
Yeah, that's a great question. And I don't know if we're on day one. Yesterday, a federal law was approved for recreational use of marijuana. And unfortunately, it did not follow the types of ideas and regulations that we would have liked in the sense that there's still some space open for commercialization of marijuana, and we thought that it was a better idea to keep control of the types of selling opportunities, and we do think that that is probably going to open, the opportunity for other types of negative commercialization behavior, as we have seen on alcohol and tobacco. Although we will need to see, right? I do think that there's a lot of space of learning across all of these problems, right? Not only alcohol, tobacco, marijuana, and other types of substances, but even food. I think that, if you look at Mexico, one of the biggest problems that we have right now is chronic diseases, obesity, diabetes, hypertension. And all of those have share very similar characteristics. I mean, some people say, well, but they are not addictive, or there's not enough evidence about addictiveness. And I just think that in terms of use, they are so similar that we should put them together, and we should try to keep track, just as I did, very quickly in the presentation. Just put them together and see what is missing from one policy to the other. And then move on and try to include those things in the legislation and in the research that we're doing.
Great. We also have a question, it's more a logistic question from Zach, about how you propose to collect data on the place of last drink. And it seems like it can be particularly logistically challenging to get that sort of information.
I think it is and it isn't, right? Because we're already collecting a lot of information through the police. So if you get involved in a violent encounter, or if you have a crash, and particularly if someone gets injured, the police is going to fill a report. And if you look at those reports, there's a lot of information that could be we could just include, one question about that. So where is it that you had your last drink? And of course, I know that some people probably will not recall the last place since the alcohol level may be too large. But I think that just by doing that and by creating a quick statistic of which places are being more frequently involved with this type of behavior, we'll start creating a norm and sort of help people to see that some of the business behavior is not necessarily good for health. Right now, it's completely hidden, right? So there's a crash, and the only person who's responsible for that crash is the person who was driving. And I just don't think that that's fair. So we'll need to move on, and we'll need to find a way to do it. Now, this other idea that I was discussing is about using cells and just seeing the volumes, right? Because we know how many establishments have a license, and we also know how many people is supposed to be within those establishments. So we could create, like a rough measure of how many standard drinks are being served per person. And I think just that will be great.
We have a few-part question from Edna from Guadalajara. about what indicators you might suggest to have an indicator of impact after an intervention or policy goes into place, and how sensitive it is for recall information from children and adolescents around drinking and smoking, or any sort of ethical implications for recalling those in survey for the measurement.
Yeah. So I think, I mean, it is of course going to depend on the type of intervention and policy that you want to evaluate, and each of them will have differences. What I will say is that it is important for you to measure the specific outcome, right? Like the final result that you want to evaluate. But I think that it is just as important to measure some of these intermediate outcomes, like information about compliance, which is something that I find very missing when we're doing research. So perhaps having both, just as I was showing you in these graphs that we have for Mexico and tobacco use in adolescents, is very informative. I mean, you're not only looking at tobacco use, but you're also looking at the perception of people around tobacco policies. And having that information makes a difference in the way in which you interpret the results. Now, yeah, of course, there's always problems with measurement in children and adolescents. And this survey, particularly the GYTS, is a survey that is self-reported by adolescents, and they are in school, so maybe there's some pressure on them not to report certain things. But across all of the cities that I showed, it is the same methodology. So I don't foresee any reason why they couldn't be comparable.
Selma has a second question about how a number of countries, at least in Europe, have started implementing legislation that limits gender-specific advertising of tobacco, as the industry had started to leverage gender empowerment to gain more customers. What do you think of this strategy overall? Anecdotally, Usama, and I can also vouch, has seen a lot of gender-specific advertisement of alcohol. And within the US, for example, wine is often advertised to one gender versus another.
Totally. No, absolutely. It is mind-blowing, when you start seeing at all of the different strategies that both of these industries are using to carve themselves a space in the market using gender-specific strategies, right? So we have, for instance, light cigarettes in the 80s or the 70s were very strongly pushed for women. And right now, as Usama was saying, wine, right? And it is not only advertising in the formal way, there's also a lot of overt advertising that you can see, right? So for me, that I have this personal bias, every time I watch a movie, I'm very aware of people smoking and drinking, and it is just amazing to see how many of these Netflix series or something like that, where with strong female leaders, are using alcohol in almost every scene, right? And I do think that is a problem, and that may explain some of the difference that I was showing you in terms of urban versus rural differences for women in Mexico. There's quite a gap there, and we need to understand better how is that women in cities are being more strongly targeted and through which mechanisms. So of course there's also a gender perspective that we should not lose from our analysis.
Ana Martinez asks about whether you can touch more on the role of funding to support all of the measures that are included in the SAFER framework. So in the case of tobacco, the best examples from places like California demonstrate the large role that funding from taxes and the settlement with the tobacco industry have played on supporting research, policies, programs, public opinion. So any elaboration on that would be appreciated.
I was just trying to avoid the pain of talking about funding, but no, I think Anna is spot on. There is a huge issue with funding, right? And as I was showing you, just for instance, monitoring is something that costs. I mean, you have to pay for surveys, and you need to get people on the field to obtain that information, and that requires money. And many of these interventions require money. Now, at the same time, when I think about structural interventions, I think about things that we're going to have to push very strong and very, very decisively for a time. But then once they are passed and once they are implemented and once they have the specific mechanisms for compliance and to maintain the strength of those regulations and those normative changes, then they become very cost effective. Funding is always an issue in both in research and also in specific actions. Unfortunately for Mexico, our federal law does not allow us to earmark taxes. And that's something that we have discussed once and again and again and again, because we do think that the taxes for alcohol, for tobacco, for food, unhealthy food, they should all be directed, at least a part, to public health. But that is a big issue and that is a big limitation. Now, despite that, I think that we have done some amazing advances in tobacco in Mexico, even with those limitations. So we need to find a way around it.
Great, I think we are just out of time for this. I know we have a few more questions, but you can join us afterwards. The link has been posted. If you're interested in joining for a more in-depth discussion, you can join this link, the one that I just last sent to the chat at 1:15. Yes, exactly. And echoed another sentiment in the chat that I think is echoed by many is thank you for the excellent presentation. For those of you who are UHC regulars, we're excited to see you. Next week is a social week for our brown bag, and I look forward to everyone coming together in a virtual space to spend time celebrating the end of the winter quarter together and the graduation of all of our second-year master's students. Yes, and Gina's also saying thanks. Lots of thanks to everybody. I hope you have a great weekend.